Welcome back. All around the Watertown community, you might notice bras like the ones that you see here, all in different locations, but they're not your average underwear. They are raising awareness about options for breast cancer patients and survivors.
Here to tell us more about Worldwide Bra Day, and the one I'm wearing is Dr. Maida Parkins with Bellissa Plastic Surgery Medispa. Welcome back.
Thank you.
Great to see you. This one is quite fancy.
I had to put it on.
That's actually our winner from last year.
Really?
That's all hand sewn.
It's a butterfly.
It is.
It is beautiful.
A bra made into this fashionable. That's incredible.
Here are the cups.
Yeah. What's the point?
This was our event we did last year. We're doing something similar this year, but it's really to celebrate Bra Day, which stands for Breast Reconstruction Awareness. We celebrate it every October for the past 4 years in the United States, and obviously before that even internationally. But it's just a day to bring to the public awareness that breast reconstruction after mastectomy or even lumpectomy is an option. So they did some research and they saw that 7 out of 10 women don't actually know that.
Really?
And if you think about all of the women that are affected by cancer and all their family, that's just a lot of people to not know that it's an option. And it's not right for everyone. We're not trying to say, oh, everyone needs to do this, but everyone needs to know that it's a choice.
That it's an option.
And so that's what it's really about.
So it's important too. I mean, just in general for women to know these topics and things. So you have, you know, a community who's coming together around this issue, doing bras like this in celebration of showcasing, you know, the different awareness techniques through
That
bras.
one's hilarious.
I know. Look at
I
that.
love that. Here, let's move this a little bit so we can see it.
What do you
Check that
think-
out.
Yeah, as we look at these and the reason behind them is clearly for the breast reconstruction. What do you think are some of the common misconceptions about breast reconstruction surgery?
I think
Set this out here.
there's two big things that people aren't aware of. One of them is that it's covered by insurance almost all the time. So
That's true or false?
That's true.
Okay.
It is typically covered by insurance. There was an act passed in 1998 that says if a health plan covers for breast cancer treatment, they also have to cover for breast reconstruction or a prosthesis.
Gotcha.
And I think a lot of people don't know that. They don't realize that.
What if you've already had a mastectomy, let's say, and you decided at that time not to do the reconstructive part, and it's been a year or 2 or more? Can it still be an option?
Still come back. That's called a delayed reconstruction, and it's never too late.
Okay.
There are options for everyone, whether it's the day you have your mastectomy or 10 or 20 years later or any time in between.
And I bet a lot of people worry too about it looking right, especially if they've had just one breast removed.
Yep. So, and I think that's another big misconception. You know, 40 years ago, we didn't have great tools and techniques. Now we have a lot of things at our disposal, and we can get great, absolutely beautiful outcomes. Some of the women like their breasts better afterwards, which is just amazing, and that's the part that I really, really like. So, I mean, we have all sorts of different implants. We have shaped implants. You can use your own tummy tissue or your back tissue. We have fat grafting, so taking fat from your belly and putting it up here to smooth out any bumps or lumps or parts where there's a little bit missing. So I think that there's, you know, we have a lot of techniques. We can do nipple reconstruction. We can tattoo the areola. So we can really kind of give the person their breast back. It's not exactly the same, obviously, but it can look really pretty good.
What do you hear patients say when they've gone through reconstruction surgery?
I think the biggest thing is psychologically, it helps them feel like a woman again.
Yeah.
As much as you say, oh, you know, it doesn't matter, it's fine. I think that just makes them feel kind of normal again. It makes them feel confident in their clothing, that people aren't looking and wondering what happened to her.
Yeah.
And you kind of brought up, what if it's just on one side? Are we going to be able to make that match? Actually, usually we can make it match. The other side, surgery on the other side, the non-cancer side, is also covered by insurance.
Interesting.
So if you have big, large, droopy breasts and we reconstruct it and it's not droopy, we can do a lift on the other side to make it match, and that's also covered by insurance.
Okay.
So that's, you know, another thing that I think lots of people don't know and don't expect.
Yeah.
It's wonderful.
What other kind of surgeries do you do outside of breast reconstruction? Are there other things that are valuable to you or to breast cancer patients?
I do all types of plastic surgery. I do probably half cosmetic and half reconstructive surgery. So, you know, there's a lot of other types of things that help people feel better about themselves or little areas that they want to fix. So I do pretty much head to toe, from eyelids, facelift, neck lift, to, you know, breast reduction. There's a lot of women who their breasts are too big. Sometimes actually we can do a breast reduction as a reconstruction technique. If they have enough tissue, the breast surgeon can take out the lump and some surrounding tissue, and then I can do a reduction on that side as well as the other. And a lot of those patients are really happy. They're like, I've been wanting these to be smaller for years. So, yeah, I mean, I do a lot, you know, tummy tucks and liposuction and a lot of cosmetic things too, but a lot of reconstructive things, skin cancers and reconstructions for that too.
Something that could be so difficult, turning, you know, seeing a positive, you know, feeling positive.
So the free fun bra day event is happening at Watertown Regional Medical Center. People can call the phone number that they see there on their screen, or visit findyourrealbeauty.com to learn more. We also want to mention Chicks with Picks. It's a concert with female musicians. It's actually sold out, but you can win tickets to that concert by attending the free event and registering, right?
Yep.
Wonderful. And it's happening October 1st.
Yep.
And here's the phone number to call so that you can reach the doctor at Bellissa Plastic Surgery and Medispa. It's 920-262-4577, or again, the website findyourrealbeauty.com.
Thanks, Maida.
Thank you.
Great to see you. Thank you so much.